Health policy is what I want to do with my life.
What I really want to do is to be able to work at the intersection of education and health.
My primary hope is to be exposed to something that's healthcare related, but that's not necessarily in a hospital setting.
Well, I'm looking to figure out what I want to do with the rest of my life, if that's going to be a practitioner or advocacy.
Through a program such as HCC, I'm able to start as an entry-level person and gain all that experience through 10 weeks. I'll hit the ground running as soon as I start.
Students can be a big promise to the future of public health, to the future of medicine and healthcare. We have a lot of issues to resolve in our nation, ranging from poor health, from inequities, from racial disparities to healthcare reform. We need the people who actually know what it's like to work in communities, to be able to make the difference.
There are thousands of students across the country who are passionate about health issues, but they don't necessarily know how to connect their passion to particular health careers. And so HCC fills that void. We provide that opportunity for an aha life discovery. This is what I want to do.
When I was an undergraduate, I participated in a program very similar to Health Career Connection. I owe a tremendous amount to the one individual that just looked at me and saw potential. He also helped me understand what I didn't see in myself. We
launched this really to achieve three goals. The first is to really inspire and empower underrepresented students and students from disadvantaged backgrounds to discover and realize their full potential through a health career. The second is to connect organizations who are really seeking to increase the diversity of their health professionals and leaders to these talented students. And the third is to contribute more leaders and professionals and people who are really going to be committed to making a difference in our underserved community.
When we started this program, we decided we wanted to really open it up to people who had interest not just in hospitals and healthcare administration, but really look for a range of placement opportunities and really understand what options were open to them. There is a broad range of places where you can really go and make a difference and contribute to the overall health of our community.
Public health by textbook is very simple. Textbooks are written after problems are defined. There is no textbook that says these are the problems that are going to come in the world. You can't foresee what's going to happen. The reason why I found HCC to be such a fascinating organization is the fact that it was trying to show people what public health and healthcare is from an experiential level and not from a textbook level.
Mentors have been important to me in my life, so I understand how crucial it is to continue doing that. It's great to see how they succeed professionally and personally, and to feel that you've been a small part of that.
I have been a preceptor at least 15 years. And what's been wonderful is that they take on these projects, it gets them out in the medical center learning about the actual operations of how we actually deliver healthcare, and above all, the energy. The energy and the enthusiasm that the interns bring, it's infectious.
I see the growth over the 10 weeks' time. It's magnificent. The students really shine. That's what you get when you work with an HCC student.
Over 60% of our students are offered a job from the place where they did their internship. A high percentage get into the top schools of public health and medical schools. We're fortunate to partner with the Berkeley School of Public Health and the Schools of Public Health at Columbia, UCLA, Harvard, and the Program of Public Health at Fresno State.
I think this is the right time and we need to push it. We're in a crossroads in this country. We need to support this sort of program, and we need businesses, hospitals, to provide these opportunities for students to explore what it's like to work in the field.
The surveys have shown that we don't have enough minorities and people of color in healthcare administration and healthcare management. We're already behind the curve. And so the contribution that we're making is we're giving a lot of people exposure to what healthcare management is about and the wide range of possibilities to really make a difference, to give back, make a contribution.
It is a cost, but we call it an investment. The students that we use at our health center have provided tremendous value to our organization over the years. We'll need more and more talented people in the healthcare industry, so I think it's definitely a crucial time for HCC to expand and work with organizations like ours to be the pipeline to develop that talent.
We have turned out very fine, committed young men and women. The very few dollars that we put into this program, it yields 10, 20 times that in terms of what these young people contribute to society.
We have grown the program from a small Bay Area based program to one that is in Northern California, in Central California, and in Southern California. And then we have regional programs in New England and in the New York, New Jersey areas. 95% of our students, when we survey them, say that the experience had a profound impact on their overall career direction. 95% of the preceptors say that this was an incredible, satisfying experience for their organization and that they would host an intern again.
We're looking for the brightest students, but we're also looking for students who have the most potential, what we call diamonds in the rough. The real success story for us is really taking those diamonds in the rough and polishing them into the future health leaders that we hope that they become, willing to not only pose the challenging questions, but try and address them.
The intern is basically just woven into the fabric of how your team is functioning and what needs to be done. By merging them in, giving them something to do, we're enriching their lives and they're totally enriching ours.
Once they get exposed to it, they're on fire. This is now what they know what they want to do. They're able to put a name to what they really are passionate about, and they've got a job and they've got a mentor and they know what graduate school they want to go to, and they're going.
If you have that love and that passion for healthcare, be it by healthcare by law, if you want to become a lawyer or MD, or if you want to be in the administration side, all those avenues, if you're interested in anything like that, this is definitely a place where you want to be.
I feel like this is the opportunity of a lifetime, and I just feel extremely blessed to be here.
The workshops were wonderful. They really had me thinking about my future and where I want to go.
It really made me aware of like the changes that need to be made from the community level, individual level, all the way up to the legislative or policy level.
I know that HCC has picked a group of interns that I really think that are going to be the change.